Thank you very much for invitation and thanks for giving this opportunity to speak. Foundation for Social Education for many years was not dedicated for migrants, and we were working with people with HIV for ages. I'm cooperate with all patient organization in Poland, but for previous year we didn't have officially key population like migrants living with HIV. We were a lot of Ukrainian people living in Poland, but they are officially workers and they are going back to Ukraine to taking treatment there and didn't use any support from Polish organization because they didn't need it. Of course, when the war was started in Ukraine, for us it was the huge challenge to face it because we exactly know what is the situation in Ukraine. We knew that this also the different phase of the epidemic because in Poland only around 30% are women living with HIV. And in Ukraine, it's more or less 47% of women living with HIV. So we knew that those people who are coming, there are many women and kids, and we should dedicate for them directly our service and our help. But in the beginning, as I mentioned about the foundation, we have three different, but of course we are working together on this topic. So one is dedicated for HIV and STIs, secondly about prevention and education, and for a third part is harm reduction. And what Julian mentioned, it's in the last few years extremely hard to work, especially about sexual education and reproductive health because of our government and everything around reproductive health, homophobic and exclusion key population, also from prevention in Poland. So you have to also know that we have very strange situation in Poland because first of all, only 10% of adult people had ever tested in their life for HIV. And this is what I mentioned on the previous session, that 87% people living in Poland think that HIV is not their problem. And we don't have too many campaigns about it, about HIV. We have available, everybody who needs treatment in Poland for antiretroviral therapy get it. And it's a separate program by Ministry of Health. We have even long-acting treatment, injectable. So everything what is the new on treatment area, we have it. So it's amazing. But from other side, if you want to take a treatment, you have to go to medical place, HIV clinic. And HIV clinic are based on the public healthcare system. So if you need to go to a public healthcare system, you have to have insurance. And before, we didn't have such a big problem with migrants people because most people are workers here, so they have automatically have also insurance. This is very important to understand. Because officially, very often you will hear that Poland has open access for antiretroviral therapy. And it's true, but it's not open access for healthcare system because you need to have public insurance. And also this is what I mentioned about late presenters. Poland is one of the highest country in Europe with late presenters. And we have last report from 2011 until 2020 showing a data and organized by Polish NHS and Public Health of Poland. And it was shocked to me when I saw that 19% of people who are diagnosed die after 6 months or between the 6 months after diagnosis. So that's mean how big level of late presenters we have and how late we are diagnosed in Poland. So I put this question and it's still on my head. Migrants or migrants. And it's also very important from Polish perspective because we have right now 3 different perspectives of migration in Poland. First of all, before the war in Ukraine, we have a huge humanitarian crisis on Belarusian border, and we still have it. We have even right now a huge wall on this border. And we have also pushbacks, and those migrants do not have access to Poland. And it happened for months, and still happen because some people, even this wall, it's more than 3 meters. Some people try to go on it. and dying also. And it's a very, in my opinion, huge crisis of humanitarian rights also. Second part is, of course, what everybody knows, what happened in Ukraine, and everybody knows that most migrants coming to Poland. We have more than 2 million Ukrainian migrants come to Poland, and from those we know that 3,500 are people living with HIV who had already have access for antiretroviral therapy. So it's quite a big number, because you have to also know that before the war in Ukraine, we have 16,000 people living with HIV on treatment in Poland. So the number during 1 year increased 20%. So for Polish system, medical system, it's quite high, and it's also very expensive to pay for treatment for this amount of people, because everybody come from Ukraine as a war migrants has open access for healthcare system in Poland, because they are treated like Polish people. They have Polish ID, Polish PESEL, and have access for everything. So it was a second group of migrants that we have in the last months. And this is also, of course, everybody knows that they are very welcome, and we try to support them as much as possible. And it was also in my head in the last few weeks, because for foundation that we have a lot of calls, people who saying, I'm coming to Poland, do you have access for antiretroviral therapy? And I said, yes, we have, but I have so many emails, contact on Messenger, WhatsApp. So I was surprising what is going on, because there are people from Turkey, but also from Kenya, from Syria, and I didn't know what is going on, because there are so many questions. We were in the beginning as a foundation a focal point for our colleagues, because what was mentioned, I'm a member of EATG, but also AIDS Action Europe, and people know that I'm working here in Poland. So when war was started, everybody connect with me, people from Ukraine. But then after many months of war, suddenly people start asking about treatment again, but not from Ukraine, from other countries. And then we officially was announced on the Polish media that it's a huge scandal, and Polish government, some visas sending, and 250,000 migrants get access to Poland with official visa. You could pay €5,000 or $5,000 and buy visa to Poland. And that's the reason why we have so many questions about it, because people coming here legally, but without insurance, because most of those people get this visa but didn't get insurance. So we had more and more people who coming to Poland and want to have access for treatment, and in many cases with people are without insurance, our HIV clinic are right now full, because they have 20% more patients than the year before. We have still exactly the same number of doctors, we have still exactly the same number of nurses, so but 20% more patients than before, and also nobody pay doctors for visiting patient without insurance. So it's also important when the numbers start increasing very, very quickly. So for example, in Poland, in Warsaw, you cannot go to the HIV clinic if you don't have insurance. You have to organize it. We try to help them. We try to organize social support, but the number is going bigger and bigger. So as I mentioned, we have the migrants before, but there are mainly people who are working here, and you can also see on the slide, this is foreigners register in Poland, so they have access. So you see that there are Ukrainians before the war, quite big number, but also other citizens from non-EU country also. So as you can see, there is prevention and treatment. We should have fully access, and it shouldn't matter what kind of migrants do you have. Are you war migrants? Are you legal migrants? You should have access for HIV treatment, because it's also a public issue, public health issue. So, as I mentioned, we have still the same number of doctors and still the same number of nurses, and we don't have so many clinics like in UK, for example. And for many people, access for HIV clinic and visit the doctor, it's the main part of the life. They don't have GPs, or they have, but they don't disclose their status. So, and they have to come every 2 months to take a treatment from HIV clinic. And it's also important to see. Sorry, it's not this slide. This slide. There is no. try to point it. This is HIV clinic, and this is the war with Ukraine, and there is no HIV clinic here in the closest area from Ukraine. So you have to go at least to Lublin or to the Krakow. The even worse thing is that we have only 5 clinics for kids living with HIV, and the closest from Ukrainian border is Warsaw or Wrocław. So it's more than 300 kilometers to travel with kids to go to the treatment. And during the last year, we have 100 kids living with HIV, came from Ukraine and stay in Poland. And before war, we have 100 kids living in Poland. And it's mostly teenagers, so it's double number during few months. And again, the same number of doctors, the same number of nurses. So this is what I mentioned based on the science that around 50% it was before few months ago. It's right now a doctor saying that it's around 20% increased number of people living with HIV. So what we did, we just have to face on it, and we are a non-governmental organization without a long support from government, so we didn't have dedicated program for migrants, but we just do voluntary work. So we very quickly try to translate all materials to open our services for migrants, and we dedicate also support for people living with HIV coming from Ukraine. We have very close collaboration with Alliance Public Health, because some of their members were in Warsaw, so we work together very closely. And we also exchange of our experience directly with this organization to know what is the real need, and also to send those people who can go directly for people who are living from Ukraine right now in Warsaw. So we also translate and prepare this material that is dedicated material about treatment and testing in Poland, that everybody can take it and see where to go for HIV test and what to do next if it will be reactive. You have to also know that in Poland you don't have open access for antiretroviral for PrEP. It's not free of charge. You have to pay for it, and a lot of people from Ukraine come to Poland and ask about PrEP. So this is our materials. We translate websites, from foundation website. We also put all information in Ukrainian language on our Facebook. We put all information in our VCT center, voluntary counseling testing. And also this strong collaboration with Help Now helps us also to have directly connection with those people who want to talk, for example, by phone. Because I was fluently speaking Ukrainian, but using Google Translator very quickly. So I answer for many questions, but it's not so easy to talk with me because I'm not speaking Russian language also. So this collaboration was also important, but also to see the real impact of the different way of migration. With Magda Bartczak, it's here. We together have mobile harm reduction service. It will be also our camper next to the expo in the during EX conference, so you can visit our car, and we are doing together because the huge impact of the situation we see in our clients with drug users. I put last year impact how many of different people from different country coming to Poland, and they are drug users and they are without insurance. And as you see, of course, Ukrainian people are a quite big group, but we have a lot of Georgian, Belarusian, Chechnya, Armenia, Czech Republic, Belarus people. So it's not only, so we see that we need much more support and much more open right now also for other migrants, because they really need our help and they for sure need our access for treatment like other people. So, and this number is still going up. And also this was very important because we've all started thinking about prevention and for access for service, but also about testing. So last year with other organization in Wrocław, with Dr. Szetela, we implement a second piloting project of self-testing, because normally you don't have self-testing for HIV in Poland. It's first time implemented by Foundation in 2020 when the COVID was when we face on COVID time. So last year, because we could get funding from UNAIDS and WHO, we implement a project again, and the result you can see on the EACS conference, the abstract. I cannot say more because we are still cannot do it. Embargo it's until tomorrow, I think. But you can see on exhibition hall. And this was also some good impact because people from Ukraine and other people also can order the test for free and get it to home and do it without any problems. So I think that's it. Oh, this is the last slide. I would like to thank all my colleagues and friends who support Poland in the last months when the war was started. And you also have to know that right now we don't have too many fundings about migration for key population migration, and we still face on the problem how to organize long-term help, support, treatment for migrants from different parts of migrants. And I don't think war migrants should have any priority. We should right now have just migrants like other countries, like UK, and should organize help, support, maybe organization to help all of those people and face on the problem that they have when they are coming to Poland. Thank you for attention.